What's up guys, it's your boy Chidi Gaines. Welcome back to my YouTube channel. So in this video guys, I'm going to be showing you guys some knee pain corrective exercises. So a lot of people at the gym will have knee pain, and this could be for a variety of different reasons. However, most of the knee pain are due to imbalances and lack of mobility in the hips and the ankle. So a lot of people focus a lot on the knees, but with knee pain, a lot of the times you need to examine what's going on the hips and on the ankle in terms of mobility and stability. So for example, nowadays a lot of people have office desk jobs where they're sitting down a lot, and this can cause the hip muscles to become very weak. And then when you're doing certain movements, the knee is going to be taking a lot of this load. The same for the ankles, guys. If everyone is walking all the time or doing a lot of activities like running, a lot of the shoes nowadays have elevated heels, and then this can cause over time tightness in the ankles, causing similar effect from the hips in terms of when you're doing particular movements. Due to the lack of mobility in the ankle joint, your knee will be taking a lot of the stress of the load, and this is particularly present if there is a clear imbalance in your right and left leg, because if you've got bad ankle mobility in the right, then you won't be able to track your knee forward as much, and then that will be taking a lot of the load in comparison to the left hand side of your leg. So in today's video guys, I'm going to be showing you certain tests that you can do in order to ascertain if you've got bad ankle mobility, if you've got bad hip mobility, and if you've got bad glute activation, guys. So if once you've done these certain tests, you'll be able to know exactly what it is that you need to work on, and the exercises that I'm going to show you guys are going to help to correct these over time. I'll tell you the certain rep ranges and sets and how frequent you need to be doing these exercises, and if you continue doing this, hopefully it will make you pain-free over time. But yeah guys, I hope you guys enjoyed the video, and the next couple of exercises will be a voiceover where I'll take you through and explain exactly what I'm doing. Okay, so the first test is a knee to wall test to test ankle mobility. So all you need to do for this test is find the wall, stand adjacent to the wall, have one leg pulled back, and then lean forward with your front leg, trying to make contact with the wall with your knee without elevating your heel. Compare to the other leg and record the distance to track progress. To pass this test, you should be able to get a minimum of a fist and a thumb's worth away from the wall, measured from the toes, and you should get the same measurement on the right and left side, guys. The second test is a hip internal rotation test. For this test, all you need to do is find a chair or an elevated surface to sit on, keep the leg at about a 90-degree angle, and rotate the thigh inwards. Your feet should be moving towards the sky. Compare to the other leg to check for any visible or obvious differences in hip mobility. This test can also be done on your back as well to check for any obvious differences, and sometimes laying on your back can make it a little bit more obvious. So the next test is to check for glute medius activation and strength. So you want to get into a side plank position and then raise your top leg up. Try and hold this for as long as you can. A lot of people with poor hip activation and glute medius activation wouldn't be able to hold this for any greater than 10 seconds, and normally they'll start to shake. The first corrective mobility exercise for your ankle is a box stretch. To complete this stretch, all you need to do is find a box or any appropriate elevated surface. Have your front feet on top of the surface and your back leg stretched out behind. Lean forward, trying to get your knees over your toes until you feel a good stretch on your calf. Hold the position for 5 seconds and repeat 12 times for 3 sets on both feet. The exact same exercise can be completed as a regression, just kneeling, as you can see in the video. So all you need to do is have your back leg nailed down on the floor, and then put the weight on your front leg, trying to get your knees over your toes until you feel a good stretch. Complete the exact same rep and set range as on the elevated surface. The next exercise is hip aeroplanes. So this stretch will really help you open up your hips and give a good stretch to your glutes and adductors. To complete this, all you need to find is something solid to hold onto in front of you. Hinge at the hips to about a 90-degree angle. Have a fair distance where you are able to bend your elbows slightly. Kick one leg back and try and keep the back knee as straight as you can. Rotate your torso down into the floor and squeeze the glutes for about 5 seconds. You should feel the stretch on the leg on the floor. Then rotate your torso back up away from the floor. Complete for 10 repetitions on both legs, and to make it a little bit difficult, try and hold it for about 5 seconds once you've rotated your torso away from the floor. The next stretch is a 90-90 stretch. So to complete this stretch, you need to sit on the floor and bend one leg in front of your body with your hip rotated out. Position it so your lower leg and knee are resting on the ground. Your leg should form a 90-degree angle and your ankle should be neutral so your foot is pointing straight. Position your other leg beside you with your hip rotated inward and your chin and ankle on the ground. Bend your knee so your leg forms a 90-degree angle. Your back knee should be in line with your hip and your ankle should be neutral. To increase the stretch, try and lean forward and put the weight on your front knee so that you should be able to feel the stretch on the forward glute. The next exercise is a touchdown squat. So we need to find a box or any appropriate elevated surface. Preferably do this exercise without shoes or even bare feet, as this allows more tactile feedback to your feet and it enables you to work the intrinsic muscles of your feet a lot better in order to maintain balance. Stand on the box with one foot and have the other feet hanging to the side. Drop your hips backwards and bend the knee on the box till your other leg hits the floor and push back up to the starting position. You can also regress this exercise by getting on a lower surface and repeating the same. You want to complete this for about 20 reps and complete on both sides. The next exercise is a wall squat hold. This one's pretty self-explanatory, guys. So all you need to do is find the wall, squat down against it, have your leg at about a 90-degree angle, and then you want to contract all the muscles of your legs, so your glutes, your quads, your hamstrings, your calves. Make sure that everything is nice and tight. Also contract the core for this and hold this for about 20 to 30 seconds. Repeat for about 2 to 3 sets. The next exercise is a resistance band abduction exercise. So you need to find a moderate strength resistance band and wrap it around your ankles or just above your ankles. Balance on one leg and move the other leg back and outwards away from your planted leg. Complete this movement 20 times whilst maintaining your balance and keeping the moving leg away from the floor. This exercise not only works on knee stability for the grounded leg but also glute activation for the moving leg, and complete this exercise on both legs. The next exercise is a glute bridge exercise. I've added a resistance band in order to isometrically contract your hip abduction muscles. So these are just your glute medius, your TFL and your glute minimus. So what I mean by isometric contraction is, as you can see, the resistance band above my knees are not moving, but the muscles at the lateral aspect of my hip will have to work hard to allow it to stay in that position. To complete this exercise, you need to lie on your back with your knees bent about shoulder width apart. Lift your hips off the floor towards the sky and squeeze your glutes for about 10 seconds. Keep your stomach flat. Once your hips are off the floor, squeeze for 10 seconds for the first 10 reps and then complete a further 10 reps at a normal pace for one big giant set. The next exercise is an eccentric 5-second goblet squat. So for this exercise, you need to position the dumbbell close in front of your chest, like shown in the video. Brace your abs slowly, sit back into a squat, counting for 5 seconds on the descent, then explode back up. Complete for 5 reps and for 2 sets. The next exercise is a straight leg raise. For this exercise, you need to lie on your back with your hips square. Bend the knee of your pain-free leg to about a 90-degree angle. Contract the quadricep muscles of your straight leg. Lift the straight leg up to about 90 degrees off the floor and lower back to the floor. Alright, so that's all of the exercises. If you want to progress the exercises, you can add sets and reps depending on each individual. So if you found this video useful, guys, please send it to anyone who needs it. Please leave a comment down below, leave a like and subscribe to my channel if you're new to the channel. But yeah, I'll meet you guys in the next video.